Hi, so 11th of March 2026. So today I'm going to go over the word clinic and clinical, which is a word that has been extensively altered from its original meaning in the 1700s. This is a follow-on to symptoms, syndrome, and diagnosis, which I have done already, looking at all the earlier definitions and how these words have been altered. And this is all part of this program to clarify very key and important word and terminology to fully understand and unpack, which I will do at the end once we've done all the words, unpack what is happening currently in the criminal and fraudulent diagnosis of mental illnesses in people, putting millions of people around the world on psychiatric drugs for a lifetime. Okay, so we're going to start. Clinic and clinical is one of those wow words, basically. And I'm going to start straight away with 1755 Samuel Johnson Dictionary, too heavy to lift here. And as usual, you will have all the photos of all the definitions in the same order as I've given them to you today. So 1755, what did clinic and clinical mean? Well, actually, it has only one meaning. And to start off with a derivation, just to set the scene, which you have to read from here because it's in Greek otherwise. Clinic actually comes from the Greek klinikos, which means to recline, to lie down, from the word kline, which means a bed. So that's a derivation etymology of clinic. And here we go. Clinic, those that keep to their beds, those that are sick, past hopes of recovery. So there were people simply in bed, sick. And a clinical convert at the time was somebody who converted on his deathbed, as in converted religion, would get baptized. And that's all it meant. That's it. Somebody who's stuck in their bed because they're sick, or relating to someone stuck in their bed because they're sick. So that's 1755. Now I'm going to close this because I have a lot of very big dictionaries and they're not all fitting on my table at the moment. Right, next one. We're going to go 1851 Webster. So we're going to jump 100 years and let's see what happened 100 years later. Okay, clinic. Same derivation, same etymology throughout. In a general sense pertaining to a bed, a clinical lecture is a discourse delivered at the bedside of the sick or from notes taken at the bedside by a physician, that's a doctor, with a view to practical instruction in the healing art. Clinical medicine is a practice of medicine on patients in bed or in hospitals. A clinical convert is a convert on his deathbed. Anciently, persons receiving baptism on their deathbeds were called clinics. So interestingly enough, 100 years later, the word clinic as a person on their deathbed being baptized, now that's become at the time ancient. And yet the clinical convert is still there being used. So that is 1851. Right, now let's go on to the next. Let's go on to the Collins 1880. Because it changes bit by bit. All right, so here we go. What do we have here? Clinical, pertaining to the sickbed, a term applied to the oral, so verbal, instruction given by medical or surgical professors to students by the bedsides in an infirmary. And a clinic, one confined to the bed by sickness. So we still have that. A clinic as a noun, somebody in bed, confined to a bed by sickness. And clinical, same definition of this treating of the patient in front of students. And this is clinical, right? By the bedside. Good. Now we jump to 1895, Lloyd's Encyclopedic Dictionary. So 15 years down the line. Let's see what happens here. Adjective, same. So not much change. Pertaining to a bed and especially to a sick bed, it is used chiefly. Now, this is very interesting. It is used chiefly in connection with instruction communicated to medical students at the sick beds of the hospital or other patients, but the more common word is clinical. And we have the same persons confined to a sick bed, and then the examination of a patient confined to a sick bed conducted by a professor in presence of his students and for their instruction. Good. Clinical convert, still the same. All right, we move on to the next. Now I use something a little bit different. I went 1944. So this is actually a beautiful dictionary. This is right towards the end of the war. And I thought, well, let's jump 50 years and see what new definition we have. And we have some new ones now. Now, quite interesting as well. So clinic, we have the same. Now they're becoming old. You know, somebody in bed, at the bedside. Sorry, somebody in bed, sick. One who received baptism. So all these are there. Now, the instruction of a class of medical students, still the same. And then we have this new one here. An institution or station often connected with a hospital or medical school for the examination and treatment of outpatients. So now we get the clinic that treats outpatients. And we have this term still now, because I know in the UK we have loads of clinics around connected to hospitals for various things. And people come in as an outpatient and get treated. And I assume that must be the same in the US, because this is a US dictionary. Okay, so that starts to appear. And then we have another one. An institution usually connected with a school, court, or settlement in which concrete cases or problems of a special type are studied and expert advice or treatment given, as a vocational clinic, a child guidance clinic, or a psychiatric clinic. Now we start having that appearing. All right, and clinical. Clinical, again, same, it hasn't changed, pertaining to the sickbed of a hospital patient as used in connection with medical instruction. Or of pertaining to or by means of a clinic occupied with investigation of disease in a living subject by observation, as distinguished from controlled experiment. All right, and then we have something very interesting that appears now. And this is worth knowing because we hear that a lot. You know, we hear clinical diagnosis, clinical depression, clinical studies. Here, clinical diagnosis. Diagnosis made from investigation of a disease in a living patient. All right, good. Now keep all that in mind. Let's get in that. Right, now I'm going to... Okay, so here we have the American Heritage Dictionary, and here there's a little extra definitions in 1990 that starts to appear, but I think it probably arrives a little bit earlier than that. And clinical, all the other definitions are the same. And you've got involving or based on direct observation of the patient, a clinical diagnosis, like the one I just read earlier on. And you have very objective and devoid of emotion, analytical. You know, he spoke in a clipped, clinical tone. So that's a new definition that's appearing. And now we're going to go into the Oxford Dictionary of English. So this is the latest copy. And interestingly enough, we have the same, a bit less, actually, because you still have the definition of gathering at a hospital bedside for the teaching of medicine or surgery. Then you have a new thing, a conference or short course on a particular subject, like a drum clinic. It's quite an interesting one. And on clinical, this is something that's appearing, and you'll see it's quite interesting, of a disease or condition causing observable and recognizable symptoms, clinical depression. But then that does beg a lot of questions, you know, because the whole idea of observing a patient and diagnosis and symptoms, which we've discussed already, there are things that you can observe. So it's very strange that now clinical has its own definition, causing of a disease or condition, causing observable and recognizable symptoms. So you would think, why clinical depression? That it's causing observable and recognizable symptoms. And funnily enough, they haven't got clinical depression here. But I did find clinical depression in this gigantic, I have big dictionaries today. It's very heavy. They're like 4 kilos. This is massive. This is a full Webster's unabridged dictionary, universal one. It's about year 2000. And it has clinical depression in there. And it's quite interesting because it goes, a depression so severe as to be considered abnormal, either because of no obvious environmental causes or because the reaction to unfortunate life circumstances is more intense or prolonged than would generally be expected. Now, the reason I bring that up is that we're going to take up the subject somewhere along the line in my, future posts. But again, we see things that you will soon see when we unpack the definition of mental disorder from the official publication of the American Psychiatric Association. You will see where suddenly all these words, you realize very quickly how they are being misused. Because the whole point of clinical instruction is you're doing it by the bedside, that the patient can be seen, and suddenly you have this new definition, which, that of a disease that causes observable symptoms. But the whole point of a disease is that it does cause symptoms that you can see. But then there are also some symptoms that you can't observe. You have to go and get tested, maybe for blood tests or for other things like that. But once you do get the test back, you can observe it. So you see how it can be, well, we'll see soon enough. If you have a woman, for example, that goes along to her doctor, and I'm going to talk about some real example here in the UK, where a very, very high percentage of women who are going through the perimenopause, coming towards the menopause, they're not feeling so well. Obviously, the hormones are imbalanced. They're probably deficient in some vitamins and minerals. So they're feeling a little bit depressed or, sad, which is to be expected when your hormones are all over the place. Now, those women are going to the doctors, and within the space of 5 minutes or 10 minutes at best, those women are offered antidepressants. Now, don't you think it's extraordinary? I think personally, I'm a man 50, so I can speak for my age band. I think it's extraordinary that these people are coming into an office, they're saying how they're feeling, and that's considered clinical symptoms enough to then put somebody on years of drugs, or drugs which are catastrophic. No investigation, no inspection. I read a definition early on about investigation. No investigation, no inspection, no examination. The only way to really know what would be wrong with somebody, from the point of diagnosis, like the word that we did in my last post, is you have to really investigate. You have to look. You'd have to do a blood test on that person, on that woman. You'd have to do some hormonal test. Really examine what is the problem, and you'd find some physical problem for sure. There'd be like hormone imbalances and so on, and then you would go to heal that person or to cure that person with the right solution. But it's just a point that I'm making here, just because about 95% of women with perimenopause at the moment who go into a UK GP wind up being prescribed antidepressants. This is in the UK. So killing off our young, killing off our women. There won't be many people left. So here you go. That's clinical. And there's a few more meanings coming up, particularly the difference between doctor and physician. And I think you will really like this post. And the original meanings of disorder and dysfunction. And then probably a couple more. And then we'd tackle, the lion's lair. That official definition, 2 pages worth. And then you see what you think.